Okay, so this next piece is a little more intensive and requires a little bit more hand skill, but I believe in you all. I believe you can do this. I do it every day. Okay, so we're going to take a little bit of your lotion of choice. I use raw shea butter because it's got, you want something fairly thick with a good amount of grip. You don't want like oil or something that's really slippy and slidey. If all you have is like regular skin lotion, that's fine. Just thicker is better, like a Lubriderm or something like that. And a little dab will do you, okay? You don't want to be slipping and sliding with this one. All right? So the idea of this is we're going to work along the peroneal muscles or the fibulari muscles, depending on, again, when you went to school. And as we're going to do that, so I'm going to use a two-knuckle fist and I'm going to use the distal phalanges of the fist right here, these little flat planes. And I'm going to form a little ring with my fingers for stability here. And I'm going to kind of sink into the tissue a little ways and just kind of scoop downward, all right? So you can see the motion there, and you just go that far. This does require a little bit of hand and wrist, but it's really not too bad. So, and you can stabilize here at the knee if you want. And I'm just gonna give you a close-up of the actual stroke so you can see how deep I'm getting into the tissue and how I'm contacting it and all that, okay? All right, so now the active component, which I think is really important, I always like to have some movement when I'm doing soft tissue work if I can get it. And so we're gonna do this. So we want to encourage supination, or we want to encourage this pronated or everted arch to lift or invert, okay? So if you look from the side, because I have really flat, narrow feet with not much arch that have a really strong bias toward pronation, okay, toward looking in like this, you can see what would normally be the arch in a foot with an arch in it is practically contacting the floor. There's really not much space here at all. So what I'm going to do is just lift that space, just so there's a little bit of space. I'm not rolling all the way over here. I'm just going to have the impulse of that, and you can see the muscle contraction there, okay? So I'm just gonna pulse it like that as I work my way down the fibulari, peroneals, however you wanna kind of speak your 2,000-year-old dead language that for some reason in medicine we insist on speaking it. We wouldn't want our patients to understand what we were saying or anything. That would be crazy. Yeah. So that's how it'll look. Okay.